Hi, I'm Colin Hung here with Healthcare IT Today, where we explore the latest healthcare technology trends in health IT. I'm here at the ESRI conference today, where we're going to explore and talk about the use of GIS in healthcare. And sitting down with me today is Eric Dick from Inland Empire Health Plan and Darren Moser. Gentlemen, welcome to the program.
Thanks for having us.
Thank you.
So maybe before we start, can you give us a little information about what the organization is and what your roles are?
Yeah, so Inland Empire Health Plan, if you can derive from the name, is a health plan within the Inland Empire, which consists of two counties here in Southern California, which is Riverside and San Bernardino County. We're a Medicare and Medi-Cal health plan. We insure a little over 1.5 million members.
Wow.
Within those two counties. So yeah, we were established in 1996. It was basically both counties got together. And we're considered a state agency. So yeah, that's kind of, I came on in 2015 as an informaticist, and my focus is basically, along with Darren, is GIS and reporting. Basically, we're heavily regulated, so we're regulated by CMS, along with a couple state agencies like DMHC and DHCS. So we do a lot of reporting about network adequacy, where our members are as opposed to where our providers are. Do a lot of mapping with that. So it's kind of is our focus here. We work for healthcare analytics. That's our department. So like I said, yeah, we do a lot of reporting basically around our membership and our providers.
Yeah.
Darren?
Yeah, just like Eric said, both of us are the part of the GIS, just the two of us with a large company, but we get all the maps done. And yeah, it's a lot of regulatory, so that time, distance, and analysis, but also exploratory. So a lot of times we'll be asked, where does a particular population, where do they reside? Is there a spatial component to cardiovascular disease or childhood immunizations, and different ways that we can help bring that, again, that spatial component to what is normally just a tabular data. So we're part of quality systems is the big umbrella in our company. And like Eric said, the data is really good. Like, they work really hard to make sure we're getting accurate information, data from the state, data from our providers. And that's a great foundation to build our maps off of.
So let's talk about some of these use cases that you're talking about here. You talked about network adequacy, but also tracking some of these conditions, it sounds like. So can you give us some examples or some more information about those use cases?
Actually, Darren could probably speak to the current one that we just did as far as our compliance with HEDIS measures.
Okay, yeah.
Yeah, so with HEDIS, which is I guess, statewide, or national-wide.
Nationwide.
Yeah, nationwide compliance. So we have specific measures that we look at, and we actually just built an application for one of our directors that wanted to see 6 specific HEDIS measures and where our providers that were not quite at our compliance levels. So we could, so we built a tool, and the great thing about the tool is it allowed us to put a pin on there and see where were members that were within like 1 or 2 miles of those uncompliant providers. And so that allows other members within our team members to take that data and say, okay, here is a great starting point to try to get those numbers up. So a lot of what we're doing is, again, looking at those populations, but also then trying to come up with solutions and answer those questions that can be answered by a web map or by a PDF.
Interesting. And what else other than HEDIS are you using GIS for?
Well, you probably speak on the time distance.
Yeah, so we do a lot of stuff that we do as far as regulatory. We don't even create a map for it.
Okay.
The GIS that's implemented there obviously is an ESRI platform. We're full enterprise licensed there. And for one of the regulatory agencies, we do time distance analysis, and that process essentially has to calculate every member to every provider in order to come up with the actual submission.
Okay.
So we're doing billions of calculations just to come up with a couple of thousand records that are being submitted. So it was a very tedious process to kind of, one, figure out what is required for the submission and then how to go about getting that. So yeah, sometimes we'll build a map just to see But when it comes to something like that, like our annual network certification, the GIS is basically just creating records to be submitted for, but there's a lot that's going on as far as that goes. We have an ETL that was developed, like Darren was referring to. Our enterprise data warehouse is really robust. So we tap into that on a daily basis, and we'll map out our entire membership along with our providers on a daily basis. And we build web applications based on that are basically considered live. Everything's being updated on a daily basis. So we can run analysis and have it be fresh, rather than once you cut that out. You're looking at a static table. It's done in a month, right? So we've really focused on maintaining that and being something that is tangible and usable and doesn't get old over the course of time. And we've been pretty successful with that.
What's the reaction been, or the impact on your members or your staff in terms of like time savings or services that you're able to provide them now?
So from where our perspective, basically, we don't see a whole lot of interaction. We don't interact with our members quite a bit, but we do work really closely with
a lot of different departments,
business units that do.
Okay.
So when we provide a product, even though Darren and I see this on a daily basis where it's really basic to us, it blows them away. Oh my gosh, you can see that provider that's non-compliant, and his members that are non-compliant are within 1 mile.
The simplest of tools, but it's magic.
Right. So to us, that's like kind of basic as professionals in the GIS realm. But when you give it to somebody that this is the first time they've seen it, they're blown away by it, and then they become an advocate for us. So when they go talk and they're using that tool and whatnot. So for us, it's been this evolution of GIS, and to the point now where we're seeing like real growth, and real usage.
Amazing.
I'd say a best practice that Eric really pushed when we started is often you get requests for PDF maps. Everybody wants a PDF map, and then you start making 80 PDF maps because they want it with this population or this layer.
Right.
And so at the beginning, when we're really trying to champion GIS, we would always make it part of our practice to create a web app anyway, even if it wasn't asked for, and then we would put a link in the PDF to that web app, and slowly that has gotten the ball rolling where, oh, I don't need 30 PDFs, I can just take that web app, and it's just education because they don't know.
Sure.
So we're finally seeing kind of the return on that investment, so that now when we're getting requests, especially for complex maps, we're not making 20 PDFs, we just make a single web app that we can easily customize to what they want.
That was probably our biggest challenge when he came on right after I did. So he was kind of following the same thing, like people like their paper maps.
They
like
love
to put them in
maps.
presentations, and
Yeah.
they've grown accustomed to having something that they can hold, or like I said, put into a presentation. So it was kind of a learning process for them when we're moving from this paper form into a digital format. There's that level of anxiety. Do I still have access to it? Is it going to show me what I want to show, what I want to see? So when we started following that convention, we started to get fans basically of it. And
Nice.
So it's been a very successful convention that we use. And it's good practice to make a web application anyway, to keep that fresh. So, if that was, for us, that was a big challenge at the beginning because we were getting all of these repeat requests, just different, extents or populations or whatever, and we could
I think another thing we did is, as you're educating, especially at upper management, you really want to standardize how you're presenting. So the way we displayed our county lines or the region areas, we kept it all very standardized so that every time, no matter what department they were in, they were looking at those maps, they knew what they were looking at.
Right.
And that really translated a lot into how we presented our membership. So it's not often we'll show all 1.5 million members, but there are times they want to see that. So we'll often do hexagon binning for our population because we have the points, but once you start to stack them on top of each other, you can't tell, is there 100 members there? Is there 1,000 members there?
Right.
So now we've actually baked in a bunch of data at different resolutions, or not resolutions, but different mile sizes.
Right.
So you can zoom in from 16 to 8 to 4 to 2 to 1. And again, that's finally paying off now where no matter where they are in the department, they can look at that and know, oh, this is what I'm seeing. We're using the same gradients, we're using the same sizes, and it pays off in the long run.
Yeah, it allows you to control that data to a challenge, again, when we're presenting to higher levels of admin, and you did some sort of heat map or some sort of density, you had to almost explain how that was created.
It took half the
using
meeting.
the neighborhood, and yeah, it was taking 15, 20 minutes just to get them to understand how it was created. So when we started using the hexagons, they were absolute values. This is per square mile, this is per square miles,
Right.
And we could nest them to where if they're, no matter what extent they were, we'd scale them, and it would zoom in and change the layer, and it was just, the transition was beautiful. So,
Nice.
and it gave us a great way to control the data, because, again, this whole de-identification of the data and whatnot, it allows us to kind of create a policy around that. So we're not going to publish something publicly that is, smaller than 3 square miles, and it's got to have at least 15 members in it, and then we can pick and choose out of that. So it allows us to remain HIPAA compliant, but still convey. And the hexagons, they cross those geographic borders, those
Right.
zip codes. So if you have an event, whether it be diagnoses or conditions or whatever that's crossing it into another zip code, it's evident. You see it. So that's a pretty big success.
That sounds like great advice for someone who's
Yes.
getting started with GIS. There's so consistency around the hexagon and the
I always campaign like the you can sit in just two of us. You can sit in your cubicle and you can wish people are going to use GIS, and you can make your paper maps, but you're constantly having to show what you're capable of doing.
Yeah.
And so the convention of making the web application, along with little things like making the hexagon tessellation, and explaining, before you know it, you get people that advocate for you throughout the organization.
Yeah, the more advocates you can get, then they're advocating to other people, and then it just grows and grows, and it's a good system.
What's next for you? Where else are you going to be rolling out GIS, or how are you going to be incorporating GIS more into some of the other processes?
Building on the ETL has always been a focus for us. We went through this whole process of building the ETL with the data warehouse, and that's been amazing. Our tech advisor for Esri, Eugene Namaste, he's just a genius
He's
when
the
it comes to
master.
that. Yeah, so he helped us get to that level, and we're constantly building on that. So not only are we just mapping out members and providers on a daily basis, we're starting to aggregate to certain geographies. Hexagons is one of them, so we don't have to manually do that on a daily basis. Governmental, legislative areas, so whether it be supervisor, Senate, Congress, we're doing that. So we're integrating all of that into our ETL so that we can just create these web applications that can maintain and be updated. So I see us kind of moving in that direction, where we're starting to bring in like diagnoses or chronic conditions or something like that into the membership, so that we can build specialized web applications based on those, and have those be live. So we'll have this whole library of live web applications that anybody can step into and use at any given time.
So it sounds like in the future, I would be able to go into your web app and kind of go, show me all the COPD patients, or show me people with heart disease and obesity.
That's the idea, yeah.
You'd be able to see it.
Yep, and then from those, we'd be able to build those dashboards.
Right.
And then we'd have those live dashboards that would be linked to those web applications. So it's going to be a lot of work, just because, obviously logistics of getting that data and whatnot, and being able to have the correct logic. Quality Systems is by far like the smartest people I've ever met. So we're right in with them. We're surrounded by smart people that are very specialized in what they do and subject matter experts, and all we have to do is just have conversations. So we're there. It's just a matter of implementing.
Amazing. Well, Eric, Darren, thank you so much for sharing the information you do with it today.
Yeah, thanks
It's
for
been
having
awesome.
us. It's been awesome. Yeah, I love the conference. It's awesome.
This has been Colin Hung with Healthcare IT Today. And if you like this interview as much as I did, please like, subscribe, and mash that like button wherever you're listening and watching. Also, head on over to healthcareittoday.com, where you can find the latest news and insights in health IT. I'm Colin Hung. Thanks for being here.